Cancer sucks, right? We all hate cancer, but there's one cancer that I really hate most of all, and this vlog is all about it. We are talking about cat oral squamous cell carcinoma. Let's do it. Let's break it down. Let's find out why I hate this cancer so much. Oral squamous cell carcinoma, or SCC, is a common cancer. It accounts for about 3 to 10% of cancers in kitties. And what's frustrating about it is we don't have a lot of good treatment options. So the take-home message for this, for me, when I'm seeing a family with a cat with squamous cell carcinoma, is that we're going to focus on comfort and nutritional support. And the problem with this cancer is it's really hard to detect them early. We're not looking in our pets, dogs or cats' mouth on a regular basis. So it's really hard to diagnose them early when they're most treatable. And they're very invasive into the underlying tissues, into the bones, the upper and lower bones. And if you watched my video on melanoma, dog melanoma, a tumor that is of the lower jaw towards the front is going to be more surgical, but the upper jaw, the maxilla, is connected to the nasal bones. And some of these tumors are of the tongue. So it just makes them very difficult to be able to remove them surgically. And they're very invasive into the bone. So they're really frustrating cancer. Occasionally, we will find a cat with a small lesion, a small tumor, and they can do well. And if you do some Googling, you do some research, or you talk to an oncologist, occasionally we'll have long-term survivors. And I have had a few cats over the years do really well with a rostral, so towards the front of the face, towards the nose, mandibular, lower jaw lesion. I had one cat that we did stereotactic radiation that lived years. So there are some occasional long-term survivors. And in the literature, in the published studies, you can find some numbers that are going to be a little bit more optimistic. But again, I do find this to be a very challenging tumor to treat because it's hard to find them early. And a lot of the different treatment options that we're going to talk about, surgery, radiation, and chemotherapy, don't really seem to add length of life to the kitties and improve their quality of life. So again, that's why I tend to go towards this palliative comfort approach to treatment. One question I often get asked is what caused this cancer? And there actually been a couple of studies that have looked at association, and 3 things have been associated with an increased risk of developing oral squamous cell carcinoma. One is environmental tobacco smoke, so kitties that live in the home with a smoker. The second one is canned tuna, so cats that ate tuna were more likely to get it, and flea collar use. So those are 3 things that have been associated with oral squamous cell carcinoma. So what are the symptoms? What might you see at home for a kitty with squamous cell carcinoma or any mouth tumor? So usually these are middle-aged kitties, so about 10 to 12 years of age. And the hard part is if they're in the back of the mouth, it may be hard to detect. But some of the things that you may see is some of the kitties are going to have difficulty eating or swallowing. They may be not eating as much. And so, we often say anorexia, so not eating, but sometimes it's not complete not eating. They're just not eating as much, or they're picky. They're not eating the same foods. They want to eat, but it just is painful for them to eat. And sometimes there's weight loss. And I have a whole separate vlog on weight loss. Weight loss can be very challenging to pick up in our own pets. They're fluffy. It can be hard to notice. My own kitty lost 3 pounds. This is me just saying it can be really hard on our own pets to know that they're losing weight. So weighing them on a regular basis is a good thing. So I'm going to put that link about weight loss because that's a really important thing to be watching. So they can be drooling. They could have stinky mouth, right? You may notice blood, blood on their bedding, blood on your bed, wherever they're sleeping, blood on the couch. You may notice blood in the water bowl. So there could be some bleeding from their mouth and you may notice that. Sometimes if it's of the upper jaw, their nose will be running. So nasal discharge, and you're going to think, well, they have an upper respiratory infection or a cold or something like that. But it could be something in the mouth as well. And then some of these tumors will actually be growing behind the eye. So the eye can be displaced, it be pushed out or pushed to the side, and that can be a mouth tumor in the back of the upper jaw, and that might be something that you see as well. And then sometimes your cat may be yawning or opening its mouth, and you may notice something abnormal in their mouth. Another way that these cancers are often found is they go in for dentistry, or they go in for some other procedure where a veterinary technician or your doctor is intubating them and they notice the mass in the mouth, or at a dental, there are teeth that are loose and they notice that there's something, abnormal underneath. In this vlog, I'm showing you some pictures of some patients of mine and some of my colleagues, and some of them are really big lesions and they're really quite advanced, and some of them, Oreo was a little one on the tongue, so they really range, but they can be quite destructive when they start to take over parts of the cat's face and things like that. So I'm sorry if some of the pictures are a little bit much, but again, I just want to show you the range of what they look like. So those are some of the things that we're going to see. In terms of the tests that we're going to do, typically to diagnose what it is, we're going to do a biopsy. We can aspirate them. If you watch any of my other videos, I love aspirates. Sometimes aspirates will not be diagnostic in these because there's a lot of inflammation and things like that. So often we'll need to do a biopsy to make a diagnosis. And your vet will talk to you about the other workup. Often, we're going to do blood work for general health screening. This is a cancer that in general does not metastasize early, so it tends to stay local in the mouth. Sometimes it will go to these lymph nodes, the local lymph nodes. Usually if it's going to spread to the chest, it's going to be late in the course of the disease. So the thing that these kitties are usually succumbing to, and I know this is hard to hear, but the thing that these kitties usually die from is poor quality of life and controlling the pain and getting them their nutritional support. Again, going back to what my goals are as their oncologist in treating them: comfort, pain control, and nutritional support. So there are some tests that we may do. I have seen a few spread over the years. They were usually pretty advanced one. I'm not saying chest x-rays aren't worth doing, but again, we're going to talk to your doctor about what tests they want to do. We're going to want to make the diagnosis to figure out which of the cancers that it is, do some blood work, make sure everything's okay for the medications that we're going to need to prescribe. You may have an early one. You may be talking about, more aggressive treatment, but these are some of the tests that you're going to be talking about with your cancer specialist or your veterinarian. Remember, I always have links below on where you can find a cancer specialist. I also do consultations through Fido Vet. Your veterinarian can consult with me and I can go over all of your medical records that way. There'll be links below. Best way to know how extensive these tumors are is going to be a CT scan, a CAT scan of your kitty, a CAT scan of your cat. And that is because, again, remember these tumors are, even though they're of the lining of the gums and everything, they're very invasive into bone. So that is going to be the best way to see how extensive they are. CT scans, I'll put another link below, but they do require anesthesia and there's added cost compared to x-rays. Problem with x-rays of the face, of the skull, are not very helpful. Dental x-rays sometimes can be helpful, but to figure out how extensive it is, there are going to be a CT scan. If we're just going to treat with palliative care, I'm not doing a lot of CT scans for cats with oral squamous. Usually the ones I'm doing CTs are the ones that we think we might be doing treatment for, so radiation, or if we found one early, we might be doing surgery. But again, it really depends on what our goals are, with treatment for this case. So I'm going to wrap up part 1 on kitty cat oral squamous cell carcinoma with that. And join me for part 2, where we will be focusing on treatment. Spoiler alert, we're going to be focusing on palliative treatment options. I'll talk to you about why I don't really emphasize surgery and radiation and chemotherapy. And my big emphasis is really on supportive or palliative options. We'll talk about nutritional support, pain management, and things like that. So please join me for part 2. Thank you so much for watching. I will read all your comments. I appreciate the positive support. Please don't forget to subscribe, and I look forward to seeing you back at the next video.